Hello and welcome to CoronaNomics, brought to you by Econ Films. This week, are we on the verge of a catastrophe in the developing world? Unlike East Asia, Europe and North America, the ability of the world's poorest countries to respond to the pandemic with financial rescue packages, healthcare and other support is often severely limited, leading to warnings of dire economic fallout, infection rates and even mass starvation. So what can be done, and how can we be sure we're doing the right thing? I'm Ben Chu, economics editor of The Independent.
And I'm Lizzy Burden, economics reporter at The Telegraph. We'll be your guides, and if you like what we're doing, please hit like, share and subscribe. Joining us are Achim Steiner, the administrator of UNDP and the man spearheading the United Nations response to the pandemic in developing countries, and Esther Duflo, who won the Nobel Prize for Economics last year for her work on poverty. At JPAL, she's pioneered the use of randomised controlled trials in economics and last year published Good Economics for Hard Times, which is clearly what we need right now. Welcome to you both.
Now, we've had some pretty dire warnings about how coronavirus could hit the developing world. Bill Gates has warned of up to 10 million potential deaths in Africa. The United Nations has warned about up to 3 million deaths on that continent. And the UN has also raised the alarm about a hunger pandemic due to disruption of food supplies. Here's David Beasley of the UN Food Programme.
But now the World Food Programme analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020.
Yet it's also true that so far the picture of deaths has been very uneven. This is drawn from data put together by Our World in Data. It shows you that of the percentage of total deaths in the early stages of the pandemic, it was upper middle income countries, mainly China. And then as time went on, it's become high income countries in that big green band. Low income countries, you can see in the top right hand corner, only account for a very small percentage of deaths so far, about 2%. So Achim Steiner, first of all, some say that those figures don't fully capture the full picture of the impact of COVID-19 on the developing world, perhaps due to deficiencies in testing and maybe in recording causes of deaths. Others say this is merely the calm before the storm. What's your view?
I think both statements are right. The first thing we have to realize is this is a global pandemic. It has arrived in virtually every country and territory across the world. Yes, we are still learning a great deal about this virus, and therefore our knowledge is limited and our understanding of quite the dynamics of its spread is still being consolidated with every day and information arriving. At the same time, clearly data is very uneven. Testing, the ability to actually trace and track people is also very uneven. So what we see right now is certainly a geographical and to some extent economically linked, but I think that's more coincidental phenomenon. But clearly we are seeing in Latin America and Africa and in Asia this virus arriving. And perhaps what is more tragic is that the economic and social fallout from this pandemic is already overtaking the health impact in some countries. And therefore we are dealing with synchronicity here on an unprecedented level.
Okay, we'll come on to that. But first of all, just thinking about the potential scale of this problem, Esther Duflo, Anne-Marie Trevelyan is the UK's International Development Secretary, and she warned quite recently that this pandemic could undo 30 years of development work that the UK had done. Do you feel that the impact could really be as bad as that?
It's not just Achille and I, it's even the medical professional, the epidemiologists, we just don't know. And the relatively low number of cases and of deaths is surprising, and it's not just measurement, because for example in India, where I do a lot of my work, we're also not seeing a lot of people rushing to the hospital for any reason. In fact, in India, the number of deaths has actually declined as people are not anymore driving and the air is cleaner, and so paradoxically the lockdown has reduced the number of deaths. So from the health side, we have a big question mark. You put the question exactly right. Is it just that it's different somehow, or is it the lull before the storm? One thing that happened is that a lot of countries in the global south have put in the containment measure earlier than the richer countries, simply because they saw what was happening in the richer country. And this may be a reason why we haven't a huge spike yet. The problem is the lockdown themselves are extraordinarily costly as well. I couldn't put a number on it as clearly as some of your guests, but it is clear that it is, if people cannot go out to do work, there is no social, the social security, social safety net don't have at all the same, ability to react fast and efficiently as in the richer economy. So people are not able to go out and get money and get food and all of that, and that also kills people. So I do not know how long the poor countries will be able to maintain the lockdown and therefore to suppress the infection unless they can at the same time be really supported to put in place robust universal social protection for their citizens.
Yes, and we'll talk a bit more about the lockdown shortly, but just in terms of the scale of this, I mean, is this sort of the biggest crisis in your professional lifetime facing the developing world as a whole, would you say?
Again, I think we don't know yet. It certainly is probably the biggest crisis in my professional lifetime, because otherwise the last 3 decades have been very good from the point of view of reducing poverty and reducing hunger and reducing child mortality. Child mortality, for example, has been divided in half. And even though it's been divided in half, keep in mind that every day, 15,000 children die before the age of 5, mainly from preventable causes. I want to remind people that this dwarfs the coronavirus. And so the fact that in the last 3 decades, there has been a halving in that number, thanks to robust action, both by the international community, but essentially by the poor countries themselves, is, I hope I will be able to remember this as the dominant feature of my professional life. Now, whether this could be entirely reverted by what's happening now, I think, again, we don't know, but to a large extent, it depends on what we do today. And by we, I mean both the government in the global south, but also the rich countries and the middle income countries that have, I think, a historical responsibility to come and help now in order to avoid this to turn into this catastrophe you were talking about. So I don't think this is something, on the health side, we don't know. It depends on the virus that we don't fully understand. On the economic side, it is entirely within our control, and therefore this is our responsibility. And we have the ability as a global community to avoid turning this into this catastrophe and setback that your guest pointed out.
Let's start to unpack some of the reasons that the developing world is so exposed. This map shows health capacity per country. As we can see, large parts of Africa have fewer than 1 doctor per 1,000 people, but across Europe, in the blue part, we can see that people have more than 3 doctors per 1,000 people. And before the programme, we showed that map to Joe Stiglitz, and here's what he had to say.
The problems that you pointed out are just touching the surface, because in the developing countries, the people are often crowded together. Social distancing is not going to be possible. Many of the people suffer from malnutrition, and this virus is particularly nasty at going after people with pre-existing conditions, diabetes, other kinds of weak health conditions, and those are pervasive in the emerging markets.
So, Achim, we'll come on to social distancing later, but what are the biggest challenges you face, and how well prepared were you for a pandemic of this size?
I think the world did indeed miss an opportunity in the last few years to prepare for such an event. This is not one of the proverbial unknown unknowns. In fact, in the work of the World Health Organization, in many of the crisis management centers around the world, precisely this kind of scenario has been played out, and yet we were caught unprepared, but also, and here let me borrow a metaphor that has become very frequent right now, with a set of underlying conditions that your graph and that Joe Stiglitz's comments refer to. We live in a very unequal world, and in a world that has very unequal capacity to respond to this. Take a countries such as the South Sudan, at the beginning of this pandemic, there were 2 ICU beds there. We have in many countries a lacking health infrastructure. 55% of the world's population do not have access to social protection. If you just take something like internet access, which is both in terms of information but also continuing education, 8 out of 10 people in the rich countries have access to broadband internet today. In the least developed countries, 8 out of 10 people do not yet have access to this. This has significant implications: business continuity of government, the ability to actually deploy the health infrastructure. But let me go back for a moment just also to the shock impact of this pandemic, because there is a degree of economic freefall playing out right now that I think we are only just beginning to appreciate, and is particularly pronounced in developing countries. Let me give you one example. The Maldives, an island nation fully dependent on tourism, the day that it had to shut down and tourism stopped, it basically ceased to have an economy. That's 60% of its GDP. Many small island developing states face that. But also look at more structural issues. For example, foreign debt. Many developing and emerging economies right now have become simply more indebted because their currencies have lost value. This could be 15 to 20% increase in their debt levels. The number of people who have lost their jobs, the fact that in developing countries, usually 60, 70, 80% of people work in the informal sector. You do not work tomorrow, you do not have money, you do not have a social safety net. These are dramatic consequences that in the short term are the equivalent of an economic freefall. And the first statistics for the first quarter of this year, whether in the United States, in Europe, and other parts of the world, already show a contraction of GDP between 3 to 5%. This is disastrous.
And Esther, what do you think makes this so much harder to deal with for the developing world?
What Joe Stiglitz said is precisely what made us, particularly worried that there would be a health explosion in developing countries because people would be particularly weak due to malnutrition, and the ability of the health system to cope with sick people is obviously not there. And the example of Sudan is extreme, but even a much bigger, much richer, much more developed economy like India is also completely under-equipped if the pandemic was going to be big in rural areas. But for the moment, this hasn't happened yet, so we don't know yet how it's going to unfold. What has happened, and that's what Achim said, is the economic fallout. What has happened is the lockdown. And in Kenya, the lockdown, as the police have killed more people to enforce the lockdown that the COVID had. And that's a direct consequence of the fact that the lockdown is such an economic blow on people.
As we've been talking about in Western countries in previous episodes, lockdowns has been the characteristic policy response, and it's been mainly to protect highly vulnerable older people in those countries. But the demography of a continent like Africa is very different. As we can see from this map, there's a considerable lower median age in Africa and many developing countries, you can see from the lighter shaded areas of this map, than there is in the West and in other developed countries. The median age in Africa is 20, 38 in the US, 40 in Europe. So to spell out what that means, it means that in Africa, half of the population is below the age of 20, whereas in Europe and the US, half the population is over 40. The question is, as you've been alluding to, is how appropriate are lockdown style policies in developing countries, given those different levels of demographic vulnerability and of course the extreme impact, as again you've been saying, of the lockdown on younger people's ability to make a living? Isn't there a danger, as development specialists often warn, of adopting a one-size-fits-all policy? First of all, maybe I can put that to you, Achim.
As Esther also said at the beginning, I think it's quite interesting because many developing countries, also on the African continent, had a kind of lead time that was longer than some of the countries that have been most affected right now. And they're very effective measures: stopping international air travel, putting different measures of social distancing, but also control of movements within countries in place, has certainly contributed to that. And I want to mention a state, a federal state in India, Kerala, where the evidence right now suggests that you also have a kind of institutional human and social capital that you build up. Kerala is known for having invested in its social services, in its health infrastructure, and because of past crises and a lot of volunteerism, was able to mobilize both the community, put in place social supportive mitigation measures, testing, tracking, and therefore has a much better track record right now of managing this than some other federal states. So I think in many developing countries, we will now see also the dividend or the lack thereof of countries having invested in those areas that often are considered to be, yes, desirable, but not at the forefront of the economic growth paradigm. And I think that has to be recognized. And yet at the same time, let us also be clear, there is in some ways three dimensions. There's a global pandemic, we have a global economy, and this is playing out brutally in a global economic sense. So even if the number of deaths on the African continent right now are not yet, and hopefully may not be at the level that we have seen in other countries, let's be very clear, the economic dislocation already through a global economy in contraction is disastrous, whether it is for oil producing and exporting countries, or whether it is simply because there's no tourism, no trade. And then there is a third dimension, which is at the level of the household. And here I think we have to distinguish also between a financial economy that we often focus on in our indices. When we read the Financial Times, we look at GDP indicators, per capita income, and the real economy, which is a person that has no money on their account, that cannot earn money tomorrow on the streets, selling things, providing services, being a hairdresser, whatever, and is faced with an existential dilemma. And that's why we are facing extreme situations of hunger increasing, extreme poverty increasing. And yes, I think we will see in many countries a loss of exactly what Esther referred to before. The progress we have made in recent decades, we could be thrown back by 5, by 10 years. In fact, in Yemen, through the conflict, we did a study and we estimate that Yemen has lost 20 years of its development progress as a result of the 4, almost 5 years of war right now.
So, Esther, it's obviously very hard to generalize, but if you were to sort of have the ear of the political leaders of developing countries as a whole, what sort of advice would you be giving? What sort of solutions would you be asking them to look at in this crisis?
So let me first answer your previous question about the lockdowns and whether they were appropriate and why countries decided to go for them. I think very early in the crisis, they had the feeling of being navigating this crisis with a blindfold on. They had no idea how bad it was going to be, whether it was going to be much worse than in the richer countries or maybe not as bad. And I think by putting lockdown in place, they bought themselves some time, and they bought themselves some time for thinking about what to do next. So in that sense, I think it actually was reasonable for many countries to do that. And now what we have to think about is what to do now, given that the lockdown are not a solution that can be expanded forever. So I think actually take the country of Togo, which is a small West African country with a per capita GDP at PPP of only $1,800 a year. And they, with their limited means, I think are doing a lot of things that you would think are the right thing to do. The first thing is that they are trying to remove the blindfold by testing people. So Togo has about 8 million people. They are trying to develop, to deploy tests in the population, not only for sick people, but on a random basis, to be able to identify where big clusters might be located. Once you have that, then that allows you to restart the economy and to keep kind of a finger on the pulse of the infection and to be able to dial back if you need to. The second thing that they are doing, and that I think is a very important and reasonable thing to do, is to support people economically. And the way they're doing that is by they have put in place a cash transfer. In many African countries, the infrastructure is actually already there to do that because a lot of people have an electronic wallet on their cell phones. And in that sense, African countries are much more ahead than the rest of the world. So the government of Togo was able to deploy a scheme very early in the crisis to give cash to people to help them weather the crisis and also to give them an assurance that it's going to be there in the future for them. When they put the system in place, and within a few days they had 1 million people registered in the 8 million country people, and as of today, about 500,000 are already getting the money. And so this twin sort of strategy, and then of course the third pillar of that is to, as much as possible, get their health system ready to treat cases. So that means retraining health workers very quickly and redeploy some of the health infrastructure to help in this crisis. So the country of Togo could do it. A lot of countries could do something like that. Of course, the country of Togo cannot do it entirely with their own resources. So the first thing that needs to happen, and this is something that the president of Ethiopia advocated for in a recent op-ed, is not only a short-term moratorium on debt repayment from the African countries, but some debt forgiving, or at least a very extended moratorium on repayment and at zero interest rate. Because as Achim was saying, just mechanically, their debt burden has suddenly exploded at the same time as their economy is collapsing. So there is no way for them to do anything if they have to deal with the debt. So that's the first thing that needs to be done. And to be fair, I think the international institutions are working on that, but they need to go more quickly. The second thing is to give these countries help in order to help them not only with their healthcare infrastructure, which the WHO is spearheading, and I'm sure UNDP is helping with, but with the emergency help to households. Again, the pipes are there, the infrastructure is there, in particular in the poorest African countries, and all we need to do is to put money in it. And I think having that will give people the confidence that they will be able to emerge out of this crisis without starving or bringing their family in starvation, and will also therefore empower the countries to have lockdown when they need them, because what is likely to be needed in many countries in the South is these stop, start strategies, as we are learning more of where the epidemic is biggest and where it is manageable. So I think this is what I would advise for the poor countries, but I would also advise for the richer countries to come behind this effort and help. You want to think as a sort of new Marshall Plan to help the countries in the South to bounce back from this crisis in the same way that Europe was able to bounce back from the World War II crisis.
Now, Achim, as Esther mentioned, the subject of outside intervention and advice, we've all heard Donald Trump complaining that the World Health Organization has been too close to China. The UNDP also works with China. In your experience, is there pressure on multilateral organizations like yours sometimes to overlook some of the faults of developing country governments in order to get things done on the ground, to get help to people who need it?
Let me first of all say that the WHO, just like UNDP and the United Nations family, we don't only work with one country or with big countries, we work with 190 plus. If you take the territories, it's over 200. In each country, we are one, there at the invitation of the country, and secondly, also as part of the country's commitment to the international principles of collaboration. So on the front of the WHO, it is not a legislative body. It has to work with the countries. So engaging with a country such as China or the United States, for that matter, on a global pandemic is not something that is legally regimented. It is a matter of cooperation. And this is the underpinning that has been so volatile in this crisis, and that the Secretary General has repeatedly appealed to leaders across the world not to start looking for reasons to be divided, but to work together. Now, obviously, our ability to work in a country will vary according to the domestic political situation. But I can tell you right now, UNDP is not in any difficulty in terms of operating. On the contrary, countries are asking us to stay because many of the international collaboration systems and institutions and personnel are struggling to keep operating right now. I am fortunate enough that in a digital UNDP strategy for the last 2 years, I've been able for the last 7 weeks to sit in my living room and digitally lead an organization where none of the offices have closed and in many respects we are fully engaged on the ground in supporting. And I think the international community's response will have to rise to 3 challenges. One is fiscal space. As Esther just mentioned, many countries simply do not have the budgets right now to put the basic mitigation measures in place, whether on the health systems crisis or on stabilizing all these people who are suddenly without income. And vulnerability is a key criterion here, both in terms of countries. We haven't talked much about crises and humanitarian crises that already existed before. They are the most vulnerable, but within each society, most of the world's poor happen to live in middle-income countries. And so again, we have to understand what the impacts of this are. A second approach clearly is, how do you begin to also create a recovery pathway that allows countries to manage both the lockdown regime, but also the restarting of the economy? And I think here, every country at the moment is learning from each other. And whether it's the WHO guidance, the United Nations, or other entities, we are all part of a learning community, and we have to learn extremely fast. The third part will be, how do we actually envisage the future post-COVID? And whether that is a year or two from now, depending on vaccines and many other factors, I think much of what is now beginning to become clear is that the underlying conditions that already weakened us in terms of our societies. Please remember, before COVID, we saw a year or two where people all over the world were stepping out into the streets because of their dissatisfaction with their political systems, economic realities, contradictions, inequality, climate change. This is now an extraordinary moment in which we either recover back into yesterday's economy and use these trillions to invest in stabilizing yesterday's economy, or we find ways in which we can actually insert the DNA of a future economy into this recovery process. And this is going to be an enormously important set of challenges and choices. And I say specifically choices, because people often talk about trade-offs. Trade-offs have some sort of artificial objectivity to it. A trade-off is a decision to do something for something and not for something else or someone. Choices are a public way of actually debating what kind of society, what kind of economy do we want in looking to the future. And I think that is part of it. But the biggest challenge, but possibly also an opportunity here, will be how we deal with debt. We are heading for a major debt crisis. Many countries were already facing debt distress before the pandemic. It will become a lot worse. And unless we find a way, as Esther said, to restructure debt, to also have a standstill in terms of repayments, just to give you a sense, this year alone, developing and emerging countries are essentially on a pathway to repay either in interest or principal over $3.4 trillion, when they actually are borrowing $1 trillion from the IMF in order to have the fiscal space to do something right now. And these are the dilemmas that we have to tackle right now and plan and do it by design, because otherwise we will slide into them by default. And it's not just a debt default, it will be an economic disaster that has global economic stability implications.
I know, Esther, you became the youngest ever winner of the Nobel Prize in Economics last year, in part due to your pioneering work that applies the medical principle of randomised controlled testing to poverty alleviation programmes in order to establish which were successful. You've said previously that good economics is the basis of good policy making, but in this situation where there's just not time to conduct such studies, how are policymakers meant to know what's effective, what's an effective intervention, and what are you working on right now?
So first of all, I don't think that it's true that there is no time. There's no time to look for, to design very elaborate, very long-ranging randomized control trial, but there is time to learn even as we move along. For example, I'll give you one example in which JPAL has been trying to be useful in generating new knowledge in the current crisis, is to find out which kind of messages are the most helpful in convincing people to adopt protective behavior for themselves and for their family. For example, so we are engaged into several large-scale experiments where we are comparing different messages simply because we don't know what is going to work the best. For example, in order to convince young people to wear masks or to stay at home or to wash their hands, do you tell them you should think about your grandmother? Or do you appeal to the collective spirit? Or do you tell them, by the way, it might not kill you, but there is some good chance that if you get sick, you would get a long-term lung damage. So do you appeal to people's collective instinct, or do you appeal to people instinct for self-preservation? We simply don't know. And it's very, very quick to run this experiment. It's almost instant. So what we've done is to broadcast different kind of messages in collaboration with governments and compare the effect in terms of people's behavior. In the US as well, there is a huge crisis in the US, which is that the minority communities, Hispanic and African Americans, are suffering from COVID at disproportionate rate. And there are many structural inequality reasons for it to be the case. The underlying conditions, also the fact that they are usually the essential worker, they live in much smaller houses. The same thing that are true internationally are true in the US, except that the disease is there. So decades and centuries, in fact, of injustice are kind of being magnified in the presence of this crisis. So, of course, we cannot address all of this through a randomized controlled trial here and now, but one thing we can do is to, again, try out different messages that are addressed to these communities. For example, so we are working on a project with many medical doctors, having them record videos. In some videos telling people, look, we understand there has been this historical inequities. What I can tell you is that I will do the best to treat you now. So if you don't feel good, come to the hospital. Or addressing the fear that some African Americans have to wear a mask, that they are going to be perceived to be dangerous. We actually run a quick survey to show that, in fact, most people think that they are protecting the communities. We are trying to convey this message and see whether it makes a difference or not. So these are the type of things that you can do within weeks, that then you can generate very effective messages that then can be diffused via all the channels, the UN systems, but also stars, governments, anybody can have with them the most effective messages to diffuse widely. So that's an example of rapid fire. Another thing that country can do now, and that we are trying to help them do at JPAL, is to use the available knowledge that has been developed over all these years. For example, we do know that when people get a cash transfer, they use it very responsibly. There is plenty of evidence that already shows that. And this is this evidence that makes us very confident to tell government, just go ahead and do it. Cash transfers are going to be helpful, they are going to be well spent, and they are going to help people weather this crisis.
Great. And Achim, obviously to do all the work that you do, you have to ask donor countries for money. But what assurances can you give them about how well that money can be spent?
I think right now it's the best investment that any country can make, for the simple reason that if we do not have the capacity to help developing countries to manage both the pandemic in its own right, but also the economic fallout, what will happen? First of all, the pandemic will continue and will come back. And that in itself raises many very dark scenarios. Secondly, the economic fallout can create not only an immediate impact on people and people's livelihoods, it can create social and economic disruption. It can fuel the kind of dissent that we saw before. And very quickly in many vulnerable parts of the world, you will see that polarization, xenophobia, hate speech, radicalization, political extremism begin to take over the center stage of societies. And what happens next, we have seen in many countries. It is politically destabilizing. It's a geopolitical security risk. And so from that point of view, I think the Secretary General's call for looking at an equivalent of what countries in the North are spending on their own response to COVID, namely around 10% or more of their GDP, is probably a reference point also for the international community, and probably too low. But it is the best investment that they can make. And I would also like to just use this opportunity to say, as the world is in many countries looking inwards, the United Nations is your extended arm of help and support, because whether it's our colleagues in the World Food Programme who are feeding over 100 million people as we talk today to help them stay alive, UNICEF, UNDP, UNHCR with the refugee camps that need to be supported and protected also. We are the world's extended hand to each other. It is not only an expression of solidarity, it is enlightened self-interest. It is what brings us together. And it is the United Nations with its staff, with its people, that actually stays when the situation gets really difficult. And that's why in UNDP also, I'm very proud of our staff, because we are all human beings. We're all scared. We're losing family members right now. And yet we are continuing to work on behalf of the international community. And yet the funding that so far has been made available in terms of additional funding is virtually zero. We've seen significant reprogramming. That is the first line that we have had with which to work and that we are using to deploy support. But I hope that in the next 2 to 3 months, and it is understandable, everybody had to look first of all at their own community, their own nation. We need to work as an international community, because only then do we have the capacity and the means to actually help countries be part of a global response to this pandemic.
I think this discussion has talked very thoroughly about the scale of the threat, the nature of the threat, and also I'm very pleased that we've got into some practical solutions and approaches to this pandemic as well. Thank you so much to our guests, Achim Steiner and Esther Duflo, for appearing on CoronaNomics.
We'll be talking to many more top thinkers in the weeks ahead to discuss how we can weather the economic storm of Covid-19. So please do stay tuned and subscribe to our YouTube channel.
And if you like what we're doing, please hit like and share.
And if you'd like to talk to us, please leave us a comment below.
This has been CoronaNomics, brought to you by Econ Films.